1 in every 6 of us suffers from a mental illness, and more than 300,000 Chicagoans deal with emotional distress from traumatic events like shootings, sexual assault, or the death of loved ones. A study showed that serious mental illness results in $193 billion lost earnings each year in the United States. Our goal is to change that by giving people proven tools to help improve the mental health of their friends and families in the neighborhoods that need it most.
We had to deal with the fact that our communities are ravished with drugs and violence. We saw an influx of people coming to our church for issues with anxiety, bipolar, and depression. That caused us to begin teaching our congregants the proper way to deal with trauma.
Right now, mental health care isn't accessible, especially in low-income minority neighborhoods. People have tried to fix this problem by temporarily giving funding to doctors to come into these neighborhoods. But when that funding runs out, so does the healthcare people came to rely on. Our project uses a successful program from our colleagues at UCLA called Families Overcoming Under Stress, or FOCUS, to help those with mental health problems. We'll partner with people on Chicago's west and south sides to tailor FOCUS to their neighborhood's needs, such as how to help people exposed to the more than 2,500 shootings that occur each year. We'll give them an intensive 12-week training program so that they can use the skills with their community members.
If you keep mental health confined to only clinic-based care, you're really only going to reach a small portion of the population. If we really bring these skills and practices to where people live, we're going to have a much greater impact on the population as a whole.
The churches are really the main places where people get this kind of attention and help. This will be sustainable over time because the desire, the motivation, the infrastructure, the social networks are already there.
There's a saying, give a man a fish and you feed him for a day. Teach a man how to fish and you feed him for a lifetime. We're doing just that for mental health care.
It is taking evidence-based practices that we use here at Rush and really handing those tools to the people who live in our neighborhoods who are impacted by this violence. I hope it is empowering for the communities to realize that they actually can be part of the solution and that we will work alongside them to make it happen.